The superior view. What are the bones? This is the Norma Verticalis, Calvaria. What are the bones that are forming the Calvaria? If you see, you can send your queries in the live chat. Inshallah, I will try to answer as best as I can. Superior view, it includes four bones. On the front, there is a single bone, that is frontal bone, shown in the blue here. On the sides, there are parietal bones. On the back, there is an occipital bone. There are three sutures visible in this view. The one running from left to right. In the coronal plane, this is called the coronal suture. As you can see, it is running between the frontal bone in front and the parietal bones in the back. Between the two parietal bones, there is this and sagittal suture. It is in the sagittal plane of your body, and it is between the two parietal bones running from front to back. And this one is the lambdoid suture. You may remember from the physics lectures of FSC and O levels that this symbol was called lambda. So it is something like that. So this is the lambdoid suture. It is between parietal bones in front and the occipital bones in the back. Let me show you the same things here. Just give me a second. I'm a little new to this, so okay. So here is the skull. This is the frontal view in which you see the face. This is the lateral view. This is the occipital view, and this will be the vertical view. Till now we have discussed the frontal bone here in the front, parietal bones here, and if we move back we will see occipital bone here. And we have seen coronal, sagittal and lambdoid sutures. Here you can see the 2 points where the sutures meet. What are the 2 points? This point where the coronal and sagittal suture meets, this is known as point Bregma, written here. And this is the point where the sagittal and lambdoid sutures meet. This point is called Lambda. These points are very important from examination point of view also, as these are the points those presents as a soft parts in a neonate skull. In a neonate skull, in a newborn, the bones have not yet met. So the point where more than one sutures meet, here the coronal suture is meeting the sagittal suture, this part is called before fusing anterior fontanelle. You are asked that what is the date of the fusion of it. It is roughly 1.5 years or 18 months. Here you can see an interesting thing. This suture was not visible in adults. This is called frontal suture or metopic suture. Originally, the frontal bone developed as two independent bones and they fused in the midline by the age of by 8 years of age, and they met and the suture vanished between them. This is called metopic suture. And so technically speaking, you will say that the front anterior fontanelle is present between metopic, sagittal and two coronal sutures. And so here is a posterior fontanelle. These are the soft spots that you may find in a newborn here, and this closes by half to 1 year. Usually it closes by 1 year. Okay, let's see what other features are present here. Let me move to the 3D model. In the 3D model, you can see, first we'll see what are the highest point. If what is the anatomical, how you arrange it anatomically. So there is the orbit. Here is the orbit. It is the inferior margin of the orbit, and here is the external auditory meatus, this point. So there are two ways of defining the anatomical plane, anatomical positioning. First, there is a rides baseline, rides line. So what we do is we take this inferior margin of the orbit and we take this middle of the external auditory meatus and we get them in one plane. We'll just do like this and like this. So this point and this point will be in one plane. So this is one way of putting an anatomical position. And second point is you take this point, inferior orbital margin, and you take this point, the upper margin of the external auditory meatus, and between them there is a Frankfurt line. So between this is the anatomical position of the skull. So if we put it in anatomical position and we look at here, so roughly this would be the part where the skull at its highest point. You can see that it is behind the lambda. It is behind the bregma, sorry. So this is the highest point, the vertex of the skull. And if we look for the other aspects, what other features are there? We talked about the bones, we talked about the sutures, we talked about the points where the two sutures meet. A very prominent feature that you can see here are these two foramina. This one, let me, and this one. So these are the two foramina. These are the parietal foramina. They give passageway to the emissary veins from the superficial veins of the skull to the sagittal sinuses that are present beneath them. And if you join these two bones, these two lines, you join these two lines, this point where this line is in the midline and where this line is joining the sagittal suture, this point is called oblivion. This point is called oblivion. So this is about oblivion. We've talked about vertex. Oblivion is roughly 1 to 2 inches in front of the lambda. So these are the only features that you must remember. A quick revision: the four bones, frontal, parietal, occipital, three sutures, coronal, sagittal, lambdoid, two points of meeting of sutures, bregma, future of the anterior fontanelle that was closing at 18 months, lambda, future of the posterior fontanelle that was closing at 1 month, and then there is the highest point as defined by the anatomical positioning of the skull. So it is in front of the this oblivion, it is ahead, it is anterior to the oblivion, anterior to the parietal foramina, and these are the parietal foramina, and in between them there is oblivion. So these are the structures that are present from the that are seen from the outside. So what are the structures that can be seen from the inside? If we cut the cap and we take it up, this is called Calvaria. The skull cap is called Calvaria. If we look inside, first before going into the features, I will take your attention to this. I will take your attention to this cut end of the bone. You can see the cut end of the bone that margins are thick and the spongy part is present between them. So this particular arrangement, the compact parts of the bones are called diploid, DIPLOE. Here is it written, diploid. So diploid आपको दो diploid दरम्यान वाला और दरम्यान में साइडों पे टेबल्स, तो ये आपको एक सैंडविच की तरह का एक स्ट्रक्चर मिलता है जिसके अंदर compact bone is on the sides and spongy is in the middle. What other things can you see here? Almost the same. There is the opening, there is again the same number of bones, same sutures, same points of joining of sutures, and the same things. Here are a few additional things are here. One, there is a groove running antero-posteriorly. This one. This is called groove for superior sagittal sinus. We will have a topic about the sinuses. So the superior sagittal sinus is lined against this point and it has created a groove here. It is narrow anteriorly. As we move back, it receives more and more veins and it gets larger in diameter. So there is this groove. Then there are these, a lot of pits are seen here. These pits are seen here, here, and as you move back, they become larger in size. These are called fovea, granular fovea, or actually there the CSF gets absorbed. Here CSF gets absorbed, and the arachnoid granulations that are formed again in the sagittal suture and the sagittal sinus that are made at this point, and they push against the bone and they create these pits, and these are known as fovea. And one last thing that is to be seen here is these markings. These markings, as you can see here. So these are the basically the markings of the arteries, the meningeal arteries that are supplying the meninges. They have created an impression in the bones. Middle, mostly they are from the middle meningeal vessels, and they have anterior division and the posterior division, and they form anterior and posterior division respectively. You will see it later that it will become important, the grooves, that one of the groove passes the point where the four bones meet the pterion, and we will see in the later view of the skull. So this is about the vertical, the calvaria, the vertical view and the inside view of the calvaria. If you have any question, please comment on in the live chat, and inshallah I will try my best to answer these. So let's move on